So this particular patient is what started my search for something different. I call him my $44,000 man. About 4 years ago, he presented 35-year-old virgin abdomen, small bowel obstruction. So I took him to the operating room. He actually had an obstruction due to a phytobezoar. Unfortunately, his post-op course was complicated by necrotizing soft tissue infection of the wound and the fascia. And so I needed something to try to repair his anterior abdominal wall. And at the time, what I used was 4 pieces of Alloderm, 1 millimeter thickness, sewn together to cover the defect, and that was sewn as a bridge repair. And he ultimately came back, of course, with a large amount of herniation at that site. I don't really consider that a product failure. I think it's an operative failure. I don't think it was the right operation for him at the time, as well as I was asking too much of that. And there's been multiple publications to show that they will have herniation recurrence in those settings. So this is where I started my search, looking for something different. And of course, the more they come, the more they keep coming. And so what are these challenges here? This is a trauma patient with evisceration of bowel that even the vac would not cover it. So I needed to sew on 2 pieces of Vicromesh just to try to contain the viscera. This is a patient that I'll discuss with a fistula. This is a patient who had a perforation small bowel due to a chicken bone. He went to the operating room, had complications because he was on immunosuppressants from his kidney transplant. Now he's left with complete loss of domain. There's this patient who came in leaking from his wound what appeared to be a soft tissue sarcoma, but ended up being just infected mesh, and then a large defect. How do we, with really no tissue left to work with, how do we solve those problems? And so when I went looking for something new, I was looking for these certain characteristics. The handling characteristics of the biologic matrix, something that's strong, something that can handle the forces of the abdominal wall in these large defects, something that will be rapidly incorporated with revascularized tissue, and that will be resilient knowing that these patients have an increased risk of wound infections. Also, as I talked about, options. I need situational awareness in acute care surgery, as we all do. What's the patient's trauma burden? What's the surgical burden of the patient? I need options. And that's what I was looking for: sizes, thicknesses, what can help me solve that problem? Whatever evidence base there is, what can I use? And in my patients, cost is key. My patients make decisions between healthcare and food. And so therefore, anytime I try to bring something new, I have to state that there's a cost benefit to this, and I'll discuss some of that. Now, the handling characteristics, as I stated, sometimes I need just large pieces in these defects, as I've shown, and I'm sure we've all come across that. Thickness can be a key issue as well. I'm looking for something that's stronger and thicker, because as we've seen in my $44,000 patient, that 1 millimeter thick tissue just could not handle the burden that it was exposed to. So can thickness actually help provide some support and strength to the abdominal wall?